Thank you very much, Madam President, and thank you very much to our esteemed Senate President. I don't even have this bill before me, Madam President, but I did review it earlier in a caucus with my colleagues. And I would just like to say a few words about insurance mandates in general, because that is what is before us today. It's a major frustration of mine being in this job over the last decade and having a lot to do with legislation on insurance. All of us, regardless of our party affiliation and our backgrounds, we want to see people have the best quality of health care possible. There's no question about that. And we also want to see people have access to the best possible health care that exists in the world. And I think overall we actually do a good job of that, particularly in this country and even more particularly in this state. The thing about it is that we have to measure each decision that we make here completely, and we need to not just highlight the positive aspect of each one of these policy decisions. There's also a negative aspect of some of these policy decisions. In this particular case, it's cost. Every time we create another requirement that every insurance policy is going to include an additional coverage or an expansion of an existing coverage, obviously that costs something. You are telling the insurance company you are going to be exposed to more claims, and yes, consumers are going to have that additional protection and coverage. But I think we fail very often to ask our constituents whether or not that additional coverage is worth the additional cost to them. And consequently, we have been adding insurance mandates as long as I can remember and driving up the cost of insurance. I'd also say that this is a dangerous path that continues to essentially create a marketplace that the actual consumer has very little control over. The way I envision healthcare and insurance would be a situation where everyone has transparency, has their eyes open about what their options are, and ultimately they have the ultimate choice. I wish we lived in a world where consumers actually knew what the cost of that healthcare product was going to be, whether it's actually services in a hospital or seeing a physician or a specialist or the cost of their drugs up front. And they made those choices knowing that they had an insurance product and what that coverage was to cover for it. If that transparency truly existed, Madam President, we would see an entirely different world. But that's not the way our healthcare and insurance marketplace works. The average consumer has no idea really what things are costing. They're relying on the fact that they have an insurance policy that they pay a premium on, and the fact that the government, the state government here, is producing laws determining what the appropriate coverage is, what the appropriate care is in some cases. And I believe that's dangerous, and it is causing our insurance premiums to continue to rise and to rise over time to the point where it becomes unaffordable. And we've seen the consequence. In recent years, we have seen the advent of high deductible health plans. This is for no other reason that insurance companies could no longer afford to provide the coverage that consumers could actually afford unless they started instituting significant deductibles to mitigate those costs. And that's unfortunate. And the number one thing I've been after in this legislature when it comes to the subject of healthcare insurance is consumer choice. The ability for a consumer to know what coverages are on their policy and to choose which ones they want and what they're willing to pay for with their eyes open. We don't do that, though. We say you must get all of these coverages and you must pay for all these coverages. And I believe that's a mistake. So this bill is more of the same, Madam President. It's just another additional coverage, which it's very easy for folks around the circle to say, oh, look what we're doing. We're making the world better, and people are going to have this new, advanced, wonderful coverage. And that is true. But I would much rather have a situation where a consumer would say, what is the cost of adding this additional dental and vision coverage? And I can check the box, yes or no. That's the world I want to live in, Madam President. And for those reasons, I'm going to vote no on this because I believe we have too many insurance mandates already. I believe insurance premiums cost too much. I believe the way we do insurance and healthcare and the way we bill for it only encourages the cost to continue to rise because there's no cost containment because there's no transparency. When we want to get serious and address those things, then we can make good policy. Thank you, Madam President.
Thank you very much, Senator.